morning. Myself Riya Thuman from FOYBPT. My today's topic for PT in cardio is chest diameter and its significance. So here's the model. We'll first measure the anterior posterior and then we'll do for the lateral. For the same, we will need two books. I will ask the patient to put the books in the armpits. So, firstly, we'll measure it from the nipple area. For the same, we need the measure tape and we need the ask to patient to put the two books in the armpit so we can measure the chest diameter. So, as we can see, for anterior posterior, it is the 37 centimeter. Now, we'll do for the lateral. We'll ask the patient to hold one from this side and one from back side. So now, we'll again measure the diameter. And for this, it is 36 centimeter. So as we have seen that we have measured the anterior posterior and the transverse diameter for the patient. For the normal value of the chest diameter in the men's are 37.8 to 39.4 inches, and in female it is 34.8 inches. In children it may vary from ages and from the sex as they are growing and developing. So now we'll know about the chest diameter significance. There are different types of significance which are involved in the chest diameter. That are respiratory functions, cardiovascular health, muscle mass and strength, body composition, athletic performance, growth and development, clinical applications. Now we'll see in the detail about this. First is respiratory function. So the chest diameter is the indicator of the lung capacity and the respiratory function. So if the volume of the lung is greater, the respiratory function would be better. Now cardiovascular health. So the chest diameter is associated with the lower the blood pressure and the reduced risk of the cardiovascular diseases. Muscle mass and strength. As the chest diameter is associated also with the muscle mass and strength, it would be associated with the greater muscle mass and the strength, and it is related to it is related to the pectoralis muscles. Now body composition. In this, the higher percentage of the lean, the higher the percentage the lean, the mass of the body. The athletic performance. In the sports, it requires the upper body strength and the endurance such as swimming and wrestling. So the chest diameter for the athletics, like those who are doing swimming and everything, would be required. In growth and development, it used to. So for the growth and development, we use the monitoring in the children's and the adolescents during the puberty. Clinical applications. The assessing respiratory functions in the patient, like such as COPD, or monitoring changes in the body composition during the weight loss or the weight gain. If there is a barrel chest, the diameter of the chest would be increased, and it can also lead to the emphysema. Thank you.